In February is American Heart Month. According to the American Heart Association, heart disease is still the #1 killer in the U.S. And doctors say it hits the Black community harder, often because of higher rates of untreated blood pressure and diabetes. Here to explain is Adetoun Sadiq. She's a nurse practitioner with Baylor Scott and White Family Medicine. Thank you so much for being with us here today.
Thank you for having me.
So let's talk about this. Why does high blood pressure tend to show up earlier in Black patients?
When we look at the numbers out there, you hear big words, big numbers, but then a major part of the problem is the biology, the human biology. So I'll go with the numbers first, okay? We'll say 60% of Americans have cardiovascular diseases. We'll say 58% of African Americans or non-Hispanic Blacks have hypertension. However, what is not being talked about a lot of times is the biology involved, or the science of the Black, the biology of the Black population body, which is something called renin, okay, which is an enzyme produced in the kidneys that helps to regulate blood pressure. Black people have a low level of renin naturally produced. So right there is a disadvantage of blood pressure management. There is also a concern about high possibility of sodium or salt retention, by the Black people. So when you think about that, as a non-Hispanic Black person, you already have a reserve of salt or sodium in your body. And when you consume the same amount of sodium as a Black person, it raises your risk factor. And of course, as we know, the higher the salt level or sodium level, the higher the tendency of developing blood pressure. So those are the scientific facts that is not being spoken about a lot. So a lot of people focus more on the numbers.
I get you.
But it's more about knowing what goes on in our body.
Yeah, and it's genetic, you know what I mean? So those are some obvious disparities right there. I mean, those are some very important reasons why, it's genetic. So what symptoms do people commonly ignore though?
Based on my clinical practice, as I've taken care of a lot of people with high blood pressure and, chronic problems, the one that I've heard or seen mostly is the nagging headache, okay? People will often describe it as headache in the back of my neck. Okay. As soon as I wake up, I just feel this nagging headache. Sometimes it's all day. The other one that is not quite common is ringing in the ears.
Oh, okay.
And people sometimes they just go about their day and just
coming up with so many other excuses, right? We all play doctor. We're like, I think it's this. It's got to be this. Instead of just saying, hey, this is an obvious, like, hello, it's a tap on the shoulder. Hello, pay attention,
Yes, they're very subtle signs, yet important, especially as a Black person. You really have to be paying attention. The other one is swelling in the legs, okay? Or the feet or the ankles especially. Some people will naturally attribute that to stress. Like, I've been stressed a lot. Just prop your feet up, everything gets better, but it's really not. Then fatigue. Okay. That could be attributed to so many things. Like so many things. Yeah. So those are almost non-conventional signs that you need to really check your blood pressure.
The ringing in the ear, though, why haven't I heard of that one before?
It's quite common.
Interesting.
And people will come to the doctor's office with just a chief complaint of, my ear's been ringing. I think I have allergies. It just wouldn't go away. And when they sit at the vital station, their blood pressure is high. And they come back. So it's very tricky. It's kind of tricky because they come into the room and it's like, my blood pressure is high just because I'm here. I'm really nervous to be here.
Yeah, you think it's that.
And it throws you off.
It does.
But then as a clinician, that's where our job comes in. You put everything together.
That makes sense. I mean, it really is a puzzle, right? So how often should adults be checking things like blood pressure, blood sugar, and cholesterol? How often?
Blood pressure, as a Black person, I really want to say every day from age 20. I typically advise my patients to buy a portable blood pressure monitor, okay? Buy a blood pressure monitor, keep it by on your nightstand or somewhere very close to you. every now and then, I know I said every day, which might not be realistic, but just make it something you typically do, like you get your, matcha, your coffee, whatever.
It should be
like
part
you
of
give
your
yourself
day.
a treat.
Yeah.
Quickly check your blood pressure, snap it on your wrist and check it. It gives you an idea what your blood pressure looks like.
Yeah.
Now, you spoke about other things. You mentioned cholesterol and things like that. Now, we can talk about that all day.
Yeah.
Because that is where your annual wellness exam comes in. And when people hear wellness, it's like, I'm fine, I'm cool, there's nothing wrong with me. Yes, you're having this exam, this annual wellness exam, because you're fine. Because you now want a professional to look at you're fine to make sure that you're really fine. Because there's a physical checkup aspect, and there is the physiological check, which is your blood pressure and any other preventative screening that is necessary. So once a year, we should all do that.
It's so important to get that checkup.
Very
What are some simple lifestyle changes that people can start today to really lower your heart disease risk? What can we do, especially as a Black American? What can be done? Something simple. I mean, you can't say, you can't make it so grand that it's going to be unattainable, right? But what's something kind of simple?
Checking that blood pressure.
Okay, just getting that checked.
You did ask for something very simple, because I can talk about exercise, that.
Yeah.
It's difficult to stick to an exercise routine. I'll be very honest with you. I've taken care of a lot of patients, But when I say check your blood pressure, it helps you to understand your body. Because it gets to a point that you know your baseline. Like, oh, my blood pressure is typically this. Imagine you come into the doctor's office and, for that day, your blood pressure is elevated and you're like, it's normally not this high at home because I check it 3 times.
You need like a point of reference in a sense.
Exactly,
Yeah.
and that's where prevention starts.
Okay, and what would you say to someone who maybe hasn't seen a doctor in years and they're like, oh, I'll get to it? What would you say? You're like, oh my gosh, I can't.
Yes.
Yeah.
No, not that I can't, because I get that a lot. I would just say the next cookout, because we're in Black History Month, and the next cookout, the next family reunion, the next family gathering. I want you to ask people in your family, who is your doctor? Because I'll tell you one very important thing that I've discovered in my clinical practice is trust. Okay, people want a doctor or a clinician that they can trust.
Absolutely.
That they feel very comfortable with. And a lot of times that comes with recommendation. And it starts within the family.
Yeah.
So at the next family gathering, you can pick up a phone, you call your cousin, whatever. Who is your doctor?
I like that.
Talk to me. Do you like that person? Do they listen to you? Do they care about you? Once you establish a trusting relationship with your clinician, everything else becomes easier.
I love that. Okay, and also before we go, what changes in care give you hope, give you promise today, where you're thinking, okay, we're heading in the right direction?
Technology. Technology. And, at Baylor Scott & White, we have so many options or ways where we can get patients in.
Yeah.
We have the e-visits. We have the symptom check. Like our patients can go on our website, on the Baylor Scott & White website, and just put in their symptoms and have an idea. I mean, we're not telling you to diagnose yourself, but it's a starting point.
Yeah.
Okay. Then we have the e-visits where you can literally, send a message to an actual clinician, a doctor, a nurse practitioner.
Just online, you can kind of like send the message.
On the Baylor Scott & White website, you impute your symptoms and a clinician is going to respond back to you.
Yeah.
If it's something they can treat you based off of your symptoms, they do that. And then we have telemedicine. Now, imagine all of this. You don't have to leave the comfort of your home. So that's where technology comes in. Then you can do telemedicine where you're on video call, video visit with an actual doctor.
It's so helpful. I've done that because sometimes you try to make a reservation or, like as, an appointment, not reservation, an appointment, and they're like, oh, we can see you in, a couple of weeks. You're thinking, what? I don't feel good now. But telemedicine, just you can contact somebody that day.
Exactly. That's where access. So imagine you as the patient, you have your information. This is my blood pressure. This is what's been going on with me. I have ringing in my ears, and you have a direct access.
Yeah.
Readily available access to a clinician remotely
Yeah.
without leaving your home. I mean, in your pajamas.
Yeah.
You know what I'm saying?
Oh, I've done it. I'm looking rough, but who cares? Doctor doesn't care.
So it's right there.
Yeah.
So information, clinician
Yeah.
available, you get the best care. So that's why I have high hopes that things can get better, you know, for the population generally, and especially for the African American population.
Anything I didn't ask you that we want to educate, you know, members of the Black community to really take control of their health? Anything that I didn't ask that you're saying, this is something, if you listen to one thing today, this is important?
The most important thing is I really want everybody to have a PCP. It's very important. You got to have a PCP, somebody who can look back at your records, somebody who can say, I haven't seen that in you before.
Yeah.
I haven't seen that in your blood work before. It's very important. You really cannot go off of I feel fine. Need to have that wellness visit, need to have a relationship with your doctor.
Your primary
And
care
ask-
physician, yes.
Primary care physician. And you have to ask members of your family or your friends.
Yeah.
So you can feel more confident
Yeah.
in whoever you choose to be your primary care physician.
It's been eye-opening. It's been great. By the way, I need a primary care physician. I have different specialty doctors, but I need to do that. I'm going to pay attention. I'm going to do that myself.
Good.
Okay.
Absolutely.
Thank you so much.